Welcome to this module on workflow and patient satisfaction, best practices and patient engagement. This presentation will review the best practices for telemedicine within a patient-provider relationship. Workflow benefits from having a systematic process. Documentation on how, when, and where telemedicine works best provides a roadmap for effective implementation. The workflow should be tested for functionality. Consider who will be responsible for which task and where they will be. Who will complete the scheduling? Who will remind the patient of their upcoming visit? If the patient needs help with the platform, who will do that? Will you have a virtual waiting room? Will you have an assistant check the patient in? Or will you see the patient directly? Afterwards, who will send the patient any follow-up materials? When preparing for a visit, check all equipment. Weekly equipment checks are best and are meant to be done 15 minutes before the visit. Practice with the equipment. Check the audio and video components and make sure they are working, and ensure that your image is in the middle of the screen and zoomed in so you are clearly visible at the patient's end. Make sure that the originating site has sent all patient documents in time for the documents to be reviewed prior to the session. Inform others that a telemedicine visit is taking place and request a quiet environment and privacy. Assure that the rooms are quiet. Close open doors and place a Do Not Disturb sign if needed. Check for external sounds and ensure windows are closed. Next, we will discuss starting the visit. You should mute microphones until the visit begins and silence any phones in the room. Ensure that the patient receiving care is comfortable and in the correct position for the camera and microphone. Ensure the patient's privacy. Be sure you have the patient's permission to conduct the telemedicine encounter. Introduce everyone involved in the visit. Introduce yourself and any colleagues on your side, and any specialist or presenters on the patient's end of the consultation. Explain that whatever is covered in a traditional face-to-face consultation will be covered in the video consultation, and that the level of service will be the same. Describe what will happen if the technology should fail during the visit. Explain what will happen in the unlikely event that an emergency occurs with the patient. A provider should be aware that taking on any patient is still at their discretion. For example, you might terminate a visit if you assess that a patient's cognitive capacity may require an in-person examination instead, or in a case where the patient's particular problem is not suited for a telemedicine visit. When conducting the visit, you follow your normal procedures as you would a face-to-face encounter with a few guidelines. Confirm the identity of the patient. You may want to spend some time discussing family, home, or other social matters to build rapport, as you would in a face-to-face consultation. Maintain eye contact with the patient by effectively using the camera and zoom in and out to pick up on any nonverbal cues. To improve communication, make use of visual aids such as imaging studies or drawing on whiteboards to support verbal explanations. If the consultation involves the discussion of sensitive information, encourage family members and/or health professionals to participate in the video at the patient's end. Summarize the consultation and check that the patient has understood the information. This can be done using tools such as the Teach Back method. You can find additional resources on the Teach Back method from the AHRQ website at the link ahrq.gov. Before completing the consultation, give the patient an opportunity to ask questions. Then ensure follow-up appointments are made. It is also a good idea to document the quality of the connection in the patient's chart. The quality of the connection may determine whether a proper assessment of the patient can be made. Ensure all documentation is complete in the medical record and forward a summary of care to the referring physician as appropriate. Turn off and store equipment, if applicable. Report any technical concerns to those responsible for maintaining the equipment. Let's pause to review scenarios that may not be appropriate for a telemedicine encounter. For example, when there is a need for a complete medical exam, when policy prohibits, for example, is this a first-time patient and their insurance will not reimburse them for this modality? In cases of chest pain or abdominal pain that's acute, and some high-risk behavioral health concerns. Live synchronous telemedicine visits are likely to be found when there's an established and ongoing relationship between the patient and provider. These visits can be used as follow-ups for typical problems found in urgent care, such as sore throats, colds, coughs, or common flu symptoms. In preparation, review the medical record and familiarize yourself with the patient's diagnosis and check that the equipment is working as needed. Self-monitor your position relative to the camera and place it at an appropriate distance so the patient can easily see you and your expressions. As the session is started, complete introductions of members and caregivers who are present, followed with a, "Hi, it's great to see you. Thank you for doing a video visit with me," to serve as a formal welcome to the visit. Next, the communication could be, "Isn't it great that we can meet to assist you without a long drive?" This helps to remind the patients of the purpose and value of the visit. On this screen, we see an ideal scenario. We see the walls are neat, without too many photos and nothing personalized. The lighting is indirect and not from under or over the provider's face. The provider looks tidy and professional. It is also appropriate to wear your name badge. Even if you are taking calls from a home office, it establishes authority. Of course, be engaged and smile to put your patient at ease. If applicable, ensure that before the visit ends, the patient understands their diagnosis, plan of care, and next steps. It is also advisable to dictate directly after the visit so the visit is well documented. This slide shows a compilation of photos of what not to do. In the first slide, the provider is too close and a window is directly behind his chair. This is distracting and puts a glare onto the screen. In the middle slide, the provider is seated correctly in the middle of the screen, but all of the lighting is coming from the back. This is a common problem in most offices. Check to review your positioning and lighting ahead of time. The provider's face cannot be seen. It is daunting to speak with someone in the dark. The last photo is clearly too bright. Remember all indirect light, no windows or doors behind you. Check your image before you meet with the patient. Be transparent. Let the patient know if you must look away so that they know you are not simply distracted. For instance, explain your movements as it happens when you need to look at files. Make sure to use clear, succinct explanations, such as, "I'm looking at your file to review your latest test results." Ensure you are actively listening to patients or care team's concerns and thoughts. Be aware of your nonverbal communication, such as looking at the clock or other items in your office. Lastly, when it is time to wrap up the visit, review and ensure that the patient, caregivers, and other team members understand the diagnosis, the plan of care, and any next steps in their care process. Answer any additional questions that might arise from the patient, caregivers, or care team. Let the patient, family, and care team know that you are available if problems should arise. This helps the patient and family move forward with confidence. Make sure to finalize all documentation in the medical record directly after the visit to ensure all information is gathered, and send any summaries of care as appropriate. Keep in mind that building rapport between patients and physicians can also be affected by the personality, communication, educational style, and the physical environment of both parties. Communication, throughout all scenarios should be based on the needs of individual patients and their families. Understanding the impact of these communication styles will help you as a provider make a good first impression and to set the tone for what is to come during a visit. Building trust is key, making it important to leverage trusted individuals such as community health workers to disseminate consistent messaging around key topics, and common questions such as telehealth options and social services. Here are great tips for establishing trust among patients from differing backgrounds. Ensure that printed media information accounts for health literacy levels and ethnic backgrounds. Utilize bilingual, bicultural, or multilingual, multicultural staff, and/or personnel and volunteers who are skilled and certified. Determine, learn, and use keywords so that you are better able to communicate and make an impact. Always be open to alternative formats and approaches to better communication. In summary, we discussed the importance of creating a systematic workflow, considering desired outcomes for patient satisfaction, and details related to etiquette. Here are a few questions for review. What are 2 steps mentioned in the presentation you should do before conducting a telemedicine visit? Before you begin, what questions should you ask the patient? Name 2 practices that are considered good etiquette during a telemedicine visit.